Overall, as I've mentioned, it's very important that we tackle the risk factors, and as you know, this is very large and encompasses a large amount of WHO's work. For example, tobacco, infant and young child feeding. I could go on, but you've got the picture. So this work needs to go on to really strengthen the action plan and make it very practical. At the heart of effectively dealing with chronic diseases is knowing what works. And last August, there was a big consultation with basically academics and our collaborating centres to find out if they wanted to prioritise what we needed to work on for chronic diseases in terms of research, where would they put their emphasis. And I think one overriding message from that was that there isn't enough known about how to do this in practice, implementation research. We know a lot about what the problem is, but we don't know a lot about how to tackle it. And that's the kind of thing that countries actually want us to focus on. So we're going to be reviewing that again this summer. All the experts who met last summer have been writing papers to kind of summarise the key points, and then we're going to be feeding that into how we basically prioritise the research agenda of some of the main funding bodies. Working in partnership, I've already mentioned it, is key to national level, but it's also key to global level. And we've begun to think through how we might do that with an international advisory group, but how we might open this up on a much broader basis, both regionally but also globally. And that's one of the key reasons why I'm so keen to be here today, because obviously we see patient representative groups as being really central to this, because so much of what we need to drive is actually based on what people are experiencing, and as we heard earlier on, that's not necessarily part of the debate, and it should be. So what we're hoping to achieve is basically action across sectors. Kimberlyn would have explained to you why that's so important, but if the whole of society shapes people's ability to be healthy or not, then we need to be working with as many people as possible to get concerted action. There's also, as you will be aware, about bringing people together, just as you have done in the grouping, to get more strength through collective advocacy. We also want to think about, well, how can we mobilise resources, how we can get some money to actually get this agenda tackled, because I could have shown you, but I didn't. But there are slides to show that if you look at where funding goes on the overall development agenda, it's certainly not going at the moment into this. And then we also need to think about how can we practically join together with people to support our countries to actually begin to take action on this, or to strengthen the action they've started. Knowing what works is really key, and knowing what's happening is also incredibly important, which is why we've put a lot of emphasis in our work on surveillance, finding out how much of the disease there is, but then also finding out in relationship to that the kind of capacity that countries have to tackle it. So really, preventing non-communicable diseases is about a whole of societal approach. It's about a whole of government approach, but governments in themselves do not have all the solutions. So if you were trying to put that into a diagrammatic way, I think at the centre of it really are people. And what we're trying to do is think about how through mechanisms, health promotion mechanisms such as health literacy, can we improve people's capability to improve their own health, but make sure at the same time that there's strong government leadership, that there's action across society, working with civil society, with the private sector, with the media, to really create that environment where people can improve their health. How does that then lead to the kind of changes in behaviour that we want to lead to positive health outcomes, but also how does that create a virtuous circle where health improvement then means that governments are encouraged to make more positive changes. So that's the kind of virtuous circle, if you like, we're trying to promote. So, as I said, at the heart of it really is governments leading. They need to obviously have the vision, they need to have the country action. It's true for many diseases, not just chronic diseases, the heart. But it is also about working with people, because chronic diseases also have the acronym of lifestyle diseases, and it's not, which makes it sound as if it's just up to people to act, but it's not quite that simple. But it is about people's behaviour, and so therefore creating that enabling environment is key. But we also need, as I've mentioned, through research and through surveillance, to make sure that we know what's happening, but also what works in terms of intervention. So I'm sure this will be very familiar to you, but I think at heart of what we're trying to do with tackling chronic disease is just to realise that this is really a co-production problem, that we need to be able to work with people, because for chronic diseases particularly, they're not something that happens in the clinic, in the community. They're not something that happens when doctors are there. They're something that happens in people's everyday lives, when they're in schools, in the workplace, when they're with their families. So we need to be thinking about how do we involve people in taking control and power over their own health, but providing the support to do that. And again, if you look at it in hard-nosed economics, it works. In terms of investment and self-care, and this kind of approach returns higher yields. However, what we also know, and it was very much a strong message in the Commission for the Social Determinants report, that autonomy, a sense of control over your own life, is actually priceless. And in fact, that is what is the foundation of all good health. So, this kind of approach is something I'm familiar with in terms of the work we did in the UK in salt. And there we very much took people on a journey of first suggesting through the fact that if slugs died when they were exposed to too much salt, it was probably quite likely it wasn't good for people, through to really giving people the information on their food packaging as they got it from supermarkets, about how you can work with people to take them through a journey, suggest that salt's not so good for you and here are the steps you need to take. But also very importantly, we did this with the food industry, so that they could work with us and we could work together to target and reduce the level of salt in food. So I was trying to think about the discussion that we might have, and I'm being a bit cheeky here, but I was thinking about some of the key roles that you have. One clearly is leadership. You're all leaders in the areas that you represent. You're very effective at advocacy, as we've heard already. Your campaigning ability or ability to work with us on things like that is key. Many of you also work in communities providing services for people, really understanding what's going on in people's daily lives, which is exactly what we need to do if we're going to be effective with this. And you also know, as I know you're going to go on to discuss this afternoon, about how quality and improving care for people can also be at the centre, because it's not just about prevention and health promotion, it's also about delivering clinical services for people. So these were just some suggestions of some of the approaches that we might work together on. Obviously, one of the ones we're keen on is to say that chronic diseases are central to poverty. That this is a problem that's not going to go away, it's going to get worse, and that if we care about things like delivery of the Millennium Development Goals, actually this is really important. We also feel very strongly that we need to be advocating for access and availability of essential medicines for patients who've got these conditions, and that they should be available. Some are on the essential medicines list, but if you then look at the statistics of the likelihood of people getting the medicines despite them being on the list when they are, they're much lower than other conditions. We also feel that self-care is an important part of the healthcare package. And this is something, as you've heard about, where does the expertise lie? Well, the thing about chronic diseases is the people who are the strongest experts are actually the patients that we serve. They're the people who really know what this is like. We need to be working on clinical quality and safety, as I've mentioned. And of course, part, I think, of what was behind the Commission on the Social Determinants of Health, but part also about this, is the way we're going to succeed is the way that many of the health problems have been tackled in the past, is actually to get people to work together to, if you like, generate a social movement, to get momentum, and to think about what we can do together, because together we have strength. So really, for me, this is a fantastic opportunity to hear your views and the discussion that comes up, and thank you very much for inviting me. It's much appreciated.